Good afternoon, everyone. Welcome to the Multi-Ministerial Task Force Press Conference. On our panel today, we have Minister Gan Kim Yong dialing in remotely, Minister Lawrence Wong, Minister Ong Ye Kung, Minister Tan See Leng, and Director for Medical Services, Professor Kenneth Mark. May I now invite the ministers to begin with a few words, please.
Good afternoon. Last week, we announced a stabilization phase to slow the rise in cases so that we can scale up our support for home recovery and our healthcare facilities. The effects of these measures will take time to materialize. Meanwhile, over the last week, we have set up COVID-19 treatment facilities. We will be adding more CTF capacity in the next few weeks. We have also made progress on the home recovery program with over 50% of infected now recovering at home instead of the hospitals. Minister Ong will give more details later. The daily number of cases has continued to rise. Based on the current trajectory, cases in the community are now doubling about every 10 days. Depending on how the trajectory will develop, we may start to see the number of daily infections rise to more than 5,000 next week. The vast majority, however, will be asymptomatic or have very mild symptoms and can recover safely at home. Dr. Tan See Leng will give an update on the dormitory situation later. Therefore, it is important that we continue to optimize our healthcare resources and preserve our hospital beds for those who truly need them. At the same time, all of us can help by reducing our social activities. Many of you I know have already done so, and I want to thank you for your efforts. Families with seniors should take extra precautions to protect them. To our seniors, I understand some of you do need to go out and get some sun and fresh air. Please protect yourself when you do so. Remember to wear your masks and avoid crowded places and keep to safe management measures. And if you know of any seniors who have not been vaccinated, please encourage them to do so as soon as possible. Let me say a few words in Mandarin. 在这段期间，病例不断的上升。如果家里有年长的人士，希望你们能够更加的谨慎，以便保护他们。安哥安弟们，如果你们真的要出门要做运动，或者是呼吸点新鲜的空气的话呢，出去的时候记得要戴口罩，也要避开人多的地方。保持安全距离，这样的话就能够保护自己。We will also continue to review our border measures, and we will be making updates on 3 fronts. First, we will align our border measures with our domestic health protocols. We will shorten the SHN duration for travelers who currently need to serve a 14-day SHN to 10 days instead. This is aligned to the duration served by persons under quarantine here domestically. Second, we will update the classification of some countries and regions to take into account the evolving situation in these places. The details are provided in the press release. Third, we will make vaccination an entry requirement for all work pass and students pass holders so that we can minimize the risk to public health while allowing such workers and students to enter in a safe and calibrated manner. Minister Tan will elaborate further. Our booster program has delivered booster shots to almost 237,000 seniors now. Given the increase in infections, we want to ensure that those who work in higher risk settings can continue to enjoy high levels of protection against infection. Therefore, the Expert Committee on COVID-19 or EC19V is deliberating on expanding the booster program to include our healthcare and frontline workers and persons in other vulnerable settings. More details will be announced when ready. This has been a difficult time for all of us. Singapore remains committed to our journey towards COVID resilience, and we are using this time to put in place the necessary support systems and adjust our public health protocols to respond to the evolving situation. I hope for your understanding and support as we work towards COVID-19 resilience together. Thank you very much. And I will now ask Dr. Tan See Leng to give an update on the dormitory situation. See Leng, over to you.
some changes in sequence. So Professor Kenneth Mark will go first.
Thank you, Minister.
All right, Ken.
Thanks. Of the patients who are currently diagnosed to have COVID-19 infection, the majority of these patients either have no symptoms or very mild symptoms. These patients are able to self-isolate at home safely and then to recover in that same home setting. Presently, this group comprises about 98% of all patients recovering from their COVID-19 infection, and this is because of our high vaccination rates in our population. We expect many of these patients to be included within our home recovery program. At this time, about 56% of all patients are recovering at home, and we see a good potential to offer the home recovery program to more patients over the next few weeks. Another 6% of all patients are unable to self-isolate in their place of residence, and so we arrange for them to stay at a community care facility or CCF to recover. We also include the additional 13% of cases who comprise people in other settings, for example, migrant workers, who are infected, remain well, and can safely isolate themselves within dedicated facilities, for example, in their dormitories. This means we already have about 75% of all persons with COVID-19 recovering from their illness without needing to be admitted into hospital for treatment. While 98% of all cases have mild or no symptoms, we remain focused on the remaining 2% of cases, and these have a need for hospital care. This includes 1.5% of cases who require oxygen supplementation while they are cared for in the general and isolation ward settings. This would be typically for about 2 to 5 days before they recover sufficiently and no longer need oxygen support. About 0.2% of cases are critically ill and need ICU care. They may be placed on a mechanical ventilator or receive other treatments for organ failure and sepsis. About 0.1% of all persons with COVID-19 infection unfortunately do not recover from the infections and they pass away. We have provided you with a table that describes further the patients who are more seriously ill, who need ICU care, and who ultimately die from their illness. And this is in Table 1 of Ministry of Health's press release today. This table describes patients who are ever in ICU or who had passed away by percentage, and it categorizes these patients based on age groups and their vaccination status. And if you look at the data, you will see that the chances of going to ICU or dying rises for older patients. In the period from the 1st of May to the 1st of October 2021, we did not have any patients below the age of 20 years in the ICU or dying. The majority of COVID-19 patients in the ICU were above the age of 60 years. But there were some patients between 20 and 60 years in the ICU. And these were mostly patients who were not fully vaccinated and had concurrent medical conditions, which increased their risk of getting a severe infection and a poorer clinical outcome. The group most at risk of needing ICU care were seniors above the age of 60 years who were not vaccinated. This represented 14.2% of unvaccinated seniors above the age of 80 years, 7.6% of those between 70 and 80 years of age, and 5.6% of those between 60 and 69 years of age. Conversely, for those who were fully vaccinated, only 1.9% of unvaccinated seniors above the age of 80, and this compares with 14.2% of that same age group among the unvaccinated group, 0.7% of vaccinated seniors between 70 and 80 years, compared to 7.6%, 0.1% of seniors between 60 and 69 years, compared to that 5.6%, needed ICU care or died. There's clearly a significant protective effect from vaccination, and no one who was below the age of 50 years and fully vaccinated needed admission into the ICU. Overall, 1.67% of unvaccinated people needed ICU care or died, compared to 0.12% of fully vaccinated persons, and this is nearly 14 times higher chance of an unvaccinated individual needing that ICU care or dying compared to a vaccinated person. So please, for those of you who still remain unvaccinated, please realize that you are endangering yourself and you do risk death if you do get infected with COVID-19 if you fall into these high-risk groups. Please go to a vaccination center and get yourself vaccinated. And if you have previously received a full vaccination regime, please do not be complacent and assume that your immune protection is permanent. It is not. If you are eligible for a booster vaccination dose, or you're in that subgroup of patients whom we know may not mount a sufficient immune response to the usual 2-dose vaccination regime to protect yourself, please do not delay and get your 3rd vaccination dose as soon as possible. We do not wish to see you infected or have a severe infection that then requires you to go to ICU if your immunity wanes over time and makes you vulnerable again to becoming infected. Thank you.
Thank you, Kenneth. Let me just start by reinforcing what Kenneth had just said. In summary, if we take all the COVID-19 infections together, 0.2% of the patients need ICU care and 0.1% have succumbed. But we can dwell deeper into this 0.2% and 0.1%, and we will see that unvaccinated individuals accounts disproportionately to these rates of ICU care and deaths. And specifically, unvaccinated people, as Kenneth mentioned, have a 14 times higher chance of ICU requirement or death. We have previously reported 12 times, but as the days go by, we build up our empirical data, and now, as the data show, is 14 times. 14 times, if you're unvaccinated, more likely to need ICU or die compared with vaccinated people. And then, if you zoom into the unvaccinated group, it is the unvaccinated seniors who are at the highest risk of needing ICU or dying. Therefore, it is very critical for unvaccinated seniors to take your vaccines. Please take your vaccines. And this is also why we are going all out through our mobile vaccination team, as well as our home vaccination team, to vaccinate as many seniors as we can. And today, we have under 80,000 seniors unvaccinated. A couple of months ago, I remember the number we reported was 200,000. It has gone to under 80,000, but we still need to vaccinate as many of them as possible. On home vaccination team, we have substantively completed all the completed vaccinations for seniors who are immobile and homebound. And many thanks to the volunteers who came forward to help us in this. All in all, they have vaccinated over 8,000 seniors who are immobile and homebound. But their work is not done because that's only the first dose. In the month of October, they will be going all out again to administer the second dose, and beyond that, administer boosters. In the meantime, over the last 2 weeks, I'm happy to also see that there's some decline in unvaccinated seniors who become the percentage of unvaccinated, or rather, let me do that again. Over the last 2 weeks, we have seen some decline in unvaccinated seniors who have become infected as a percentage of total cases, as a percentage. So it is now ranged from 0.7 to 1.2% every day. Percentage of total infected, 0.7 to 1.2% are unvaccinated seniors. There's some decline, and we really hope it will go down further. It is very important for unvaccinated seniors to continue to reduce your social activities and your movement, and for the families to take care of them so that you do not bring the virus to them inadvertently. Seniors who are vaccinated are at much lower risk of severe illness if they encounter a breakthrough COVID-19 infection. But nevertheless, Our vaccine booster program is accelerating, and I strongly encourage vaccinated seniors to take your booster shots as soon as they are offered. In addition, as a matter of prudence, it will also be advisable for vaccinated seniors to also limit your social interactions and activities during this period. And those who live with seniors also to help take care of them. Now let me move on to talk about healthcare capacity and our response system. We need to adjust this model as we deal with the surge in COVID-19 infections. Let me start with the highest tier of response, which is ICU. ICUs are for the most severe cases. Currently, we have 34 patients in ICU, and we expect the ICU occupancy to rise because there's a time lag before rising infection numbers translate into appearance of severe illnesses. So we have already stood up 134 ICU beds now, and we have triggered the next surge plan to increase ICU beds to 180. Next tier will be hospital beds. And now hospital beds are supplemented by COVID-19 treatment facilities, or CTFs. So currently we have 1,700 COVID-19 hospital beds and 580 CTF beds. This is also the area where we are facing the biggest crunch. And the reason why we are facing the biggest crunch is because we are admitting, or hospitals are admitting, many patients for close observation, even though their conditions do not require acute hospital care. And that is why we need to set up CTFs, increase the capacity of CTFs, and CTFs have the medical capabilities and resources, including oxygen supplementation, to safely manage such patients who has potentially higher risk of developing severe illnesses. So we will, and if we can do that, we can decant and and place patients away from hospital settings into the CTFs and therefore ameliorate the crunch at the hospital end. So we will be stepping up another 700 CTF beds at Singapore Expo and another 200 CTF beds at Sengkang Hospital. And later on, we will be setting up also at Yishun and Renci community hospitals. And all this will be done within the month of October. In the middle of October, we expect to have 1,500 CTF beds, up from the current 580. By end of October, we should have 3,700 CTF beds. And that will complement hospital beds. Next tier will be CCFs, community care facilities. And these are to house those who are actually well, but for various reasons need to be isolated from the rest of the family. And we have 4,300 CCF beds now. And finally, the last tier is actually our own homes through the home recovery program. Because of our high vaccination rates, over 98% of infected individuals are actually well with no symptoms or mild symptoms. And so the best way for them is to recover at home, which is safe for them, safe for their family, and safe for the community. Currently, as Kenneth mentioned, over half, if you take a stock figure, over half of COVID-19 patients are recovering at home, ranging 52 to 56%. 20% are in CCFs, 10% are in hospitals and CTFs, and the remaining are in settings such as the dormitories. The situation for home recovery program has improved, I feel, with the great help of the SAF. And they are operating the program now end to end. A lot of work, a lot of resources, commitment have been devoted to resolve all the teething issues that was encountered. So we can now onboard almost all new cases every day, quite smoothly. There are the occasional delays for some, mostly because of lack of information, or the information like contact numbers were not accurate. Other than that, every day they can quite smoothly onboard everyone on home recovery program. Helpline resources are being beefed up to enable those who need to contact us to do so. This is an area that we are still improving. We are aware that many patients on home recovery tried to call but couldn't call through. So this is an area that we are immediately beefing up resources on. We have also ramped up our telemedicine services by bringing on more providers, including our primary care providers in the community. While they have been very busy, they so far have been able to cope because almost all patients on HRP are well and do not actually need to call the telemedicine doctors frequently. From 1st of October, we are also working with the People's Association to provide ground support to individuals who are on home recovery program. There are still many improvements to be made, including to scale up the program to handle more cases. And SAF and MOH are actively working on these measures. All these changes I mentioned earlier are to prepare ourselves to handle the next doubling cycle, which could potentially be 3,200 local community cases, and beyond that, perhaps even 5,000 cases. A major challenge besides the physical facilities is the need to find and deploy doctors, nurses, and medical teams to run these facilities. And this is actually even more challenging. So I'd like to make a call out to our general practitioners and nurses out there to help us man and run some of these facilities. And for doctors to help join the telemedicine team to help take care of those on home recovery program. So if you are available to help us, we welcome you into the Volunteer SG Healthcare Corps. I will put out the details on how to volunteer through social media. Let me just have a word on boosters, just to reiterate some of the numbers. We fired, or we sent out 50,000 SMSs today to invite those from age 50 to 59 to come forward for your boosters. Add to those who were sent earlier, we have sent a total of 550,000 invitations. Out of that 550,000, 350,000 have either booked an appointment or gotten their jabs. And as Minister Gan has reported, 237,000 have already received their booster jabs. And that's quite a significant and an encouraging number. Finally, let me make a point which is quite important. We need to streamline our healthcare protocols. The testing and isolation protocols from QO, HRW, HRA, RRT, quite a bit of alphabet soup. They were designed during a time when we were trying to snuff out every cluster that we discover and detected. While we are in a totally different position now, as we try to ride safely through this transmission wave to emerge more resilient on the other side and able to live with COVID-19. Further, the protocols are many and complex to the man in the street. And to them, it's confusing and even frustrating. Few people truly understand or remember it. It needs to be addressed, and this issue needs to be addressed, because if people don't understand, they can't do their part to exercise personal responsibility, much less help others. It also contributes to an overall apprehension that COVID is a very serious disease, when actually for vaccinated people, it has become a mild disease. So the MTF is reviewing all the protocols holistically, and we hope to be able to present them soon. We want to make it simple, easy to remember as possible, so that everyone can do our part in our fight against COVID-19. Thank you. I'll pass the floor now to Minister Lawrence Wong.
Thank you. Good evening. Thank you to the members of the media for joining us on a Saturday evening. We are 1 week into the stabilization phase, so we thought it would be useful to give everyone an update on the overall situation. I'd like to start by thanking everyone in Singapore for cooperating with the new measures that were introduced as part of the stabilization phase and the reduced group sizes. I would also like to thank everyone for your patience and understanding, especially those who have been adjusting to the teething issues in our new healthcare protocols, like the ones for home recovery. There are teething issues. We know it is frustrating for those who have difficulties getting through to our helplines, and that's why, as Minister Ong said just now, the entire team is working flat out together with reinforcements from the SAF to resolve these outstanding issues. Meanwhile, we continue to monitor the infection situation closely. Up to now, we haven't really experienced the full impact of the tightening measures that were introduced in the stabilization phase, because it takes at least 1 week for any such measures to see results. But already, we are seeing some signs of slowing in the rate of transmission. Just to illustrate, on 3rd of September, we had 210 local community cases. Now, by community cases, I didn't include dormitory cases because they are in a different category, and later on, I'll invite Dr. Tan to say more about them. But look at community cases without the dormitory cases for the time being. 3rd September, we had 210. By 9th of September, it doubled to over 420. So that took 6 days to double. 7 days later, on 16 September, it doubled to over 840 cases. Again, a doubling at about a week. Then on 28 September, which was about 12 days later, it more than doubled slightly to 1,700 cases. So the doubling time has become longer, and now we are hovering around 2,000 local community cases a day. So there is some, looking at the data, it would suggest that the doubling time of cases has started to take a bit longer, from a week to about 10 days now. And we will continue to monitor the situation over the next few days to see what impact the new measures have in slowing down the rate of transmission. To be clear, as we have stated before, we do not expect the new measures to help to bring down the total number of daily cases. Rather, the new measures are aimed at slowing the rate of increase of transmission, and that's to give us the time to stabilize all the healthcare protocols we talked about and to strengthen and enhance capacity in our hospital system. Of course, no wave will last forever. Right? Eventually, at some point, even with after you see some of the results of our latest measures, eventually it's not going to bring the cases down, but it will slow the rate of increase, and eventually, at some point, the wave will crest. It's hard to tell when this will happen or what the peak will be. We consulted experts from our universities on this matter, and there are a range of different views. Some think that the wave can peak at about 5,000 new daily cases or slightly above that. Some think that it will go much higher to around 10,000 daily cases. So there is a range of uncertainty. No model can predict with absolute certainty what the epi curve will look like in the next few weeks. But it just simply means that we have to be prepared for these range of possible outcomes. Whatever the curves, whatever the new cases are in the coming weeks, we just have to use this time to have enough capacity to deal with the wave of cases and to review, update, and simplify our healthcare protocols, as Minister Ong said just now, so that people can understand and can comply with the measures. So that's what we are doing during this period. Of course, when we see such a surge of cases during these few days, several thousand a day, I know it can be quite worrying, and you have two sorts of very sharp reactions from different people. One group says, look, it's so high, let's quickly lock down and bring cases down. Another group says, well, this is completely to be expected. After all, we talked about living with COVID, so move forward. And let me just respond briefly to these two groups. The reaction to the first group that wants to tighten further is, look, we have gone beyond that point. We have already said, because of our high vaccination rate, we are no longer focusing solely on headline numbers. Our focus is on the people who are seriously ill and to make sure that our healthcare system is able to take care of them. That remains our focus. So let's not get too carried away by the headline numbers or too anxious or fearful about those numbers. Our response to the second group who wants to continue opening up is this. Please be patient. Our overall strategy to reopening has not changed. But this is the first time we are experiencing such a big wave, and it is causing tremendous stresses on our healthcare system and our healthcare workers. Procedures, protocols have to be changed and adjusted. New capacity has to be added into the system. All this takes a little bit of time, and that's why we are putting in place these measures in the stabilization phase so that we can get all these things ready. Even as we go about this exercise during this period, this week and over the next few weeks, I think we should also be prepared that this will not be the last wave we experience. We are riding one big wave now, but we should be mentally prepared that there will be subsequent waves to follow. Why is that so? It's because we are one of the most COVID-naive populations in the world. Unlike, for example, many other European countries, we have kept infections in Singapore low for a very long time. Many European countries experienced large waves last year, if you recall. They went through these waves before they had the chance for their people to be vaccinated. And many countries ended up paying a high price, suffering high fatalities because of the waves that they experienced last year. But now, they have a much higher level of natural immunity. And together with the vaccination programs that they have introduced, many of these countries have reached a new COVID stable situation where they are able to resume activities and they have not seen any resurgence of cases. We are in a different position. In many ways, we are fortunate because we are facing this wave now with a much more highly vaccinated population. And that means that the vast majority of our people will be protected against serious illness. And that also means that we can get through this and any subsequent waves with fewer casualties than the European countries. And eventually, we will reach a point with high vaccinations and with a higher level of natural immunity, we too will eventually reach a point, perhaps months later, where we are more similar to the European countries and the COVID situation stabilizes and we are able to reopen more confidently without seeing a new wave of cases. So as we get through this process of experiencing these waves, I think we have to remember something, that is, for the vast majority of people who catch the virus in Singapore, because of our high vaccination rates, 98%, the vast majority of them will have zero or mild symptoms. And we can all recover from home for the 98% of cases. There is nothing to be fearful about. In fact, there's nothing to be embarrassed about if you catch COVID, because sooner or later, many of us will end up catching the virus. But we will have zero or mild symptoms recover from home after a few days, we will be able to get back on our feet and go back to work. But for the 2% who fall seriously ill, we have to take care of this group, and we have to take care of them in our hospitals and in our COVID treatment facilities, which we are building more of. 2% may appear small, but 2% of a large number of people who are infected is quite a sizable group. And that's why, as I say again, we are using this time to stabilize all our protocols, make sure the procedures are in place, and build up the necessary capacity in our healthcare system to take care of this group, so that even as we experience this and any subsequent wave, we will be able to ensure that anyone who needs medical care will be appropriately treated, and we can ride the curve while minimizing any unnecessary deaths. So the bottom line is that we remain committed to our reopening plans and to be a COVID-resilient nation, and we will do so while safeguarding lives and protecting livelihoods of everyone in Singapore. Let me turn to Dr. Tan, who will give you an update on the situation in the dormitories.
Thank you, Lawrence, and good evening, ladies and gentlemen. Manpower Ministry has been working steadily to strengthen the resilience of all of our dormitories. We have vaccinated more than 90% of our migrant workers. We have been consistently monitoring new infections, and the vast majority of the infected workers have displayed very mild symptoms or they are asymptomatic. They also do not require hospitalization or oxygen support, and they are able to recover very quickly on their own. So we will continue to maintain the surveillance on migrant workers with ARI or acute respiratory illness symptoms. And this is in addition to wastewater testing and also ensuring that our workers continue to comply with the schedules for the rostered routine testing, our RRT. Now, in spite of all the measures, there has been a rise in cases in the dormitories. We started out with less than 100 a day, and now, over the last couple of days, we have seen cases rise to over 500 a day in just the last few days. Now, this is the result of the Delta variant being a lot more transmissible, and the dormitories have not been insulated from the transmission of the virus. This is just like what we're experiencing or what we've experienced in the community. Now, I think what is important and what's worthy of note is that the vast majority of the infected workers who are fully vaccinated continue to be well and asymptomatic, even when they are carrying the virus. So therefore, we would have to take a different approach in managing infections in the dormitories. We will align public health measures for migrant workers in the dormitories to the latest healthcare protocols for the community as prescribed by the Ministry of Health. This will enable us to further mitigate the risk of further transmissions in the dormitories in a more scalable and also a more sustainable manner. It will allow us to focus our attention on the symptomatic cases and those who need medical care without disrupting the livelihoods and the lives of the other workers. So we will make adjustments to our healthcare protocols in 3 key areas. First, we will increase the use of fast and easy testing through the antigen rapid tests, or ARTs, to make testing more convenient and faster for both workers and their employers. And this will allow for earlier the identification of infections. We will shift away from the polymerase chain reaction tests for asymptomatic individuals, but we will retain the PCR tests only for symptomatic individuals. The antigen rapid tests will be self-administered, but they will have peer or dormitory operator supervision. And the workers in the dorms have been trained, and instructional materials in their native languages have also been made available to all of them. Now, secondly, we will tighten contact tracing rings to focus on those who are most at risk of being exposed to the virus. In particular, these are the roommates of confirmed cases on PCR tests. The roommates and the close contacts of those tested positive on ART will no longer be quarantined and disrupted from work. They will take an ART test and be asked to monitor their own health, and if negative, they can continue to work and live as per usual. This will reduce, ladies and gentlemen, this will reduce work disruptions for migrant worker residents as well as their employers, while at the same time still safeguarding public health. Third, as the vast majority of infections are asymptomatic or they have very minor symptoms, we will allow fully vaccinated workers with no symptoms in some dormitories to self-isolate in the dormitory recovery facilities, or DRFs, that we have set up. These DRFs will provide them access to monitoring through thermometers and oximeters, as well as telemedicine support as and when they need it. They will do the ART tests every 3 days, and they can exit from the dorm recovery facility as soon as their ART test result turns negative. Symptomatic workers will be given a PCR test, and if positive, we will take more precautions and we will convey them to a community care facility, a CCF or hospital. Now, by doing this, we ensure that every worker has appropriate care, and we can focus medical resources and capacity for symptomatic or serious cases who need it most. We will also minimize life and work disruption for large numbers of close contacts. With these new adjustments, employers and dormitory operators would have to adjust their workflows and processes as well. Now, I would like to seek the support, the patience, and the understanding, as well as cooperation of employers and dormitory operators on this, as we navigate towards making our dormitories more resilient for our workers. Please be assured that the Manpower Ministry will be here to walk every step of the journey with you and work through any operational challenges that you may encounter. To all of our migrant worker brothers living in the dormitories, I would like to reassure them that they will continue to receive the appropriate medical care if and when they require it. We will also continue with the weekly community visits, which is capped at 500 workers for now. We will continue to watch the situation closely, and we will progressively ease measures when we are able to do so. The Manpower Ministry will continue to monitor the situation closely. We will fine-tune and refine our strategy and health protocols from time to time in alignment and in accordance with the Ministry of Health to take care of our workers. And these adjustments will enable us to reduce disruptions to our migrant worker brothers' lives and work while protecting public health. I will just say a few words in Chinese, please. 随着社区和宿舍感染病例的增加，我们将根据卫生部所制定的安全管理措施，调整客工宿舍的防疫措施。我们将从3方面着手。首先，我们将更加广泛地采用抗原快速检测，简称为 ART， 通过快速又简单的方式让客工自行检测。第二，我们将采取更集中的追踪行动，针对那些比较有可能受到病毒感染的客工，从而尽量减少对雇主所造成的影响。第三，我们将允许无症状或轻微症状的客工在宿舍康复设施里进行自我隔离，并且为这些客工提供远程医疗资源的服务。我想对客工和 和雇主们说的是，人力部做出这些调整是必要的，为的是要保护客工们的安全。因此，我们在此希望大家能够尽量配合，同心协力，一起走向官病共存的新的常态。谢谢大家。
Questions from the media, please.
Dear members of the media, we will now begin the question and answer segment. Please remember to use the raise hand function if you'd like to ask a question, and a reminder to keep to one question only. The first question is from Ke Yang from Zhao Bao. Ke Yang?
Hi, good afternoon, ministers and Dr. Prof. Mark. Over the past few days, we have noticed a couple of old folks who passed away on the same day that they are diagnosed with the infection. What was causing this delay in the diagnosis that could have resulted in them falling too sick to recover? And of the cases that was detected over the past few weeks, how is the breakdown of the the method of discovery? How were they diagnosed? Thank you.
Maybe Kenneth, you can explain.
It was difficult to pick up the question itself. May I ask, were you asking about the fact that there were some seniors who passed away very shortly after the diagnosis was made? Your question wasn't very clear because the message was a bit garbled.
Okay, I'll repeat again. Over the past few weeks,
speak slowly.
Over the past few weeks, there were a few cases that passed away on the same day that they were being diagnosed. So what was causing the delay in the diagnosis? And then for the cases that were being picked up, what's the breakdown of the cases that were picked up? Were they due to health warnings and then they went for a check, or were they from the SASH clinics, etc.?
Thank you very much for the question. For those who have passed away shortly after diagnosis, it's not necessary that there was a delay in diagnosis. Many of these patients, as you know, were seniors, some of them very frail, many of them unvaccinated, and when they got infected, they in fact deteriorated very quickly. Some of these people may have delayed presenting themselves for testing or for diagnosis, so they may have also delayed going to see their own doctor. Notwithstanding what the circumstances were which led to their diagnosis being made, when they had their diagnosis made, we did make effort to bring them into the hospital and attend to them and provide them with the appropriate care as necessary. So it's not the case that all these patients had delays in diagnosis. I don't have the information today about the proportion of patients who were asymptomatic and picked up either through some form of routine testing, whether under a HRW or quarantine setting, or whether or not they had some symptoms and therefore attended a GP in a SASH clinic for testing itself. We can look at the data and see whether it's possible to organize it in a fashion that makes it a big sense for your readership, and if so, we will provide that to the media.
Just to add one more comment, I think bottom line is still this. Once you are vaccinated, the chances of that happening, a rapid deterioration of a senior, is drastically reduced. So bottom line is still, please persuade our seniors to get vaccinated as quickly as we can.
Thank you, DMS.
Next
Minister.
question.
The next question is from Ray from the Straits Times. Ray?
Hi, good evening, ministers. My question relates to the map that was released by MOH recently on the areas in Singapore where COVID patients have visited recently. So I know Minister Wong, you said earlier that there shouldn't be any shame or fear in catching COVID because many of us will do so sooner or later. So some people have actually said that this map is causing some fear. Some people are saying it's alarmist. So can we find out what's the intention behind this map and how does it help as we journey towards this endemic situation? Thank you.
Thank you for that. I think we accept those reactions. And if we need to review, we'll review the practice. But I think the spirit behind this is that there are also many Singaporeans and individuals who wrote to us and say, can you give us some indication? Where are the cases? Where are the locations? So that we can regulate our own activities and our own movements. And which we think it is actually quite a civic-minded thing to do. So I think we are, as we mentioned, really feeling our way forward as we ride through this wave. And we, from MOH's perspective, and I think the MTFs as well, is if we can, as far as possible, give people the information, the tools, the procedures, so that everyone can take their own action to do their part. And we think a map like that, which actually many European cities do publish as well, I think it can help individuals taking their own initiative to regulate their movements, and the map will change over time. But let's give this initiative a try, and we'll take feedback, and we need to adjust the practice, we will do so.
Thank you, Minister. Dear members of the media, a reminder, please to stick to one question. The next question is from Deborah from Channel News Asia. Deborah?
Hi, good evening, ministers and DMS. Thanks for taking my question. So my question is, well, some local health experts have recommended stopping asymptomatic testing as a way to mitigate the caseload surge. And it's also a way to transition to living with COVID. So is this one of the streamlined health protocols that you could be considering that you mentioned during the briefing? Thank you.
Thank you very much for the question. Indeed, we are re-looking at all our protocols, and one of the areas we're looking at is how to address people who have no symptoms at all, and whether or not we need to test them. Already, as far as our protocols are concerned, we have lightened up. So for example, if you're asymptomatic for any reason, you happen to be doing an antigen rapid test at home, and you find yourself positive, we no longer recommend that you must come into the hospital, you must see a SASH clinic, you must get automatically PCR tested. And we emphasize that these individuals can exercise social responsibility, self-isolate, and self-monitor themselves for any symptoms they may have. And if after 3 days a repeat ART test is now negative, they can actually then resume their activities. And that's a socially responsible thing to do, to make sure that they protect others around them, whether in the household, in the neighborhood, in the community, while at the same time managing the fact that they had an antigen test that was positive. There are some other settings, even with asymptomatic people, where we do prefer to still maintain a slightly higher degree of caution at this point in time. And this is where these individuals have regular contact and close contact with vulnerable people, whether in the nursing home setting, in the hospital setting with patients, and where because of their contact with vulnerable people, who themselves may not be able to protect themselves through vaccination, like children, then to clarify their status, there would be some importance. And therefore, in this very highly select settings, they may still undergo a PCR test. However, as we said, we are looking to simplify our protocols, simplify the processes, and we will relook even in these use cases whether there is value to continue with PCR testing. And once we have made some decisions about what the changes are, we'll make the announcements in due course.
Can I just also add to what DMS said, that if you look at the different test regimes that we have, in fact, in many instances, we have already moved to weekly antigen test as opposed to weekly PCR test. And because we are using antigen test, in that sense, it's already a way where the antigen test really do not pick up the cases with low viral loads. They are not so sensitive. Antigen tests are, someone described to me as contagiousness tests, right? So for people with very low viral loads, asymptomatic cases, less likely that the antigen test will pick up a positive case because, it's very low viral load. But when the person has a high viral load and is more likely to be infectious, that's when the antigen test will pick up the case and will be more sensitive. So in that sense, if you look at many of our testing protocols, we are already making that shift towards using the rapid antigen test kits, which are essentially identifying the cases with higher viral loads and who are more likely to be infectious. The point about reducing the load on the hospital system is a different point. I don't think we should be saying, let's test less deliberately so that we have fewer cases and therefore a lesser load on the hospital system, right? Testing is, we will have to review, as DMS talked about, the whole range of testing protocols to make sure that they are fit for purpose. But the way to address the healthcare system, the issues around the healthcare system are several. Number one, make sure that we have the right protocols in place so that for the vast majority, 98% of cases who are mild, asymptomatic, rest at home, and therefore you will not load on the healthcare system. And then we have to make sure that the home recovery processes are in place, which we are doing so now. And then for the remaining 2% who do need treatment because they are likely to be serious cases, then we have the capacity in place either in our hospitals or in our COVID treatment facilities to take care of them. So having these admission criteria properly administered across the entire spectrum of cases will be essential to make sure that the medical resources are properly allocated to those who are seriously ill.
Just to share a fact that might be useful in our understanding of usage of antigen tests is that, Delta is a lot more transmissible, which causes a lot of problems everywhere in the world. But one little mercy it has is that it used to be that in the other earlier variants, when NCID tried to culture the virus, if you have a CT value of above 30, you can't culture anymore. Means if your CT value is 30, it suggests that you can't infect others. For Delta, that CT value has dropped to 25. So above 25, NCID can't culture the virus anymore. And because it's at 25, actually, antigen tests can pick it up much better than if it's 30. So in a way, because of the behavior of this variant, antigen tests actually become more sensitive than before, which also suggests there can be a wider usage and better usage of antigen tests.
Thank you, Minister. The next question is from Sandra from ARD German Radio and TV. Sandra?
I think you're muted, Sandra.
Can you hear me now?
Yes.
Yep.
Thank you. At the moment, we are in a situation where you can have a 12-year-old who is fully vaccinated and who has to do home-based learning, whereas a 70-year-old who's not vaccinated can go to a hawker center for drinks and lunch. That seems like a contradiction to me. And also, have you thought about making vaccination mandatory for the most vulnerable groups like the seniors?
DMS?
Yeah, I'll take the last question, which is concerning mandatory vaccinations. We are not ready to look at this issue of making vaccinations mandatory because the vaccines that we use in a national vaccination program are at this point in time still not fully approved for use by the Health Sciences Authority. They are currently being used under our pandemic special approval status, the PISA approval status, and we await HSA's further evaluation to determine whether they are ready to grant full approval, and at that point in time, that may allow us then to decide whether different strategies need to be put in place to promote further vaccination coverage. But certainly at this time, we are awaiting further evaluation to determine whether the Health Sciences Authority will be able to grant the vaccines we currently use that full approval status. Of the 2 vaccines that we currently use under the National Vaccination Program, one of the vaccines, that's the Pfizer-BioNTech Comirnaty vaccine, it has received full approval status with the FDA in the US. The manufacturers have submitted data to us and are undergoing the evaluation process, and we look forward to the Health Sciences Authority's decision soon. The other manufacturer has yet to attain that full registration status with the FDA, and we also will await submission of that data accordingly with us for us to be able then to process that accordingly. So at this point in time, given that the 2 vaccines still remain under a provisional approval status, we are quite comfortable to continue with our vaccine promoting strategies as they are now, but we will reevaluate that situation once the Health Sciences Authority recognizes these vaccines and grants these vaccines full approval status.
A very quick point on the safe management measures. We are of course very mindful of the need to protect our seniors, and we would like very much to bubble wrap them so that they get less, minimal exposure to the virus. But we are also sensitive to their overall needs and well-being. And if you keep them cooped up at home for prolonged durations, it's also not good for their health and their well-being. And that's why we're trying to find a balance where it's safe for seniors to go out, get some fresh air. I think we should allow them to do so. And our hawker centers and markets in Singapore are largely community spaces, open air, where many seniors go out to get food. They may not stay there to eat, but they need to get food there and bring it home. And that's why we have kept these spaces open to allow our seniors to do so. But we are always mindful of the risk, and that's why we continue to encourage everyone. If you are living with a senior, and if it's possible, then please, help to get the food, help to do the daily activities, and try to minimize any unnecessary outdoor activities for the seniors. But from time to time, it's obviously necessary for the person to go out, get some fresh air, do some exercise. So avoid crowded places and do all these activities safely. So it's really about getting this balance right.
Maybe I should also, sorry, go ahead.
Thank you, Minister. Just to expand specifically on Sandra's question, we are encouraging at this stabilization phase for all of us to minimize our activities outside home. So avoid unnecessary activities for all of us to work from home as far as is possible. And that also includes for all to minimize the social interactions we have, because these social interactions lead to more close contact with others and the potential for community spread increases. And this applies for adults as they do for young children. But we do recognize for a variety of reasons, people do need to leave the house. That includes people going to hawker centers, food centers to buy food. To some extent, it's a necessary activity, and we do tolerate some level of that activity as well. And in the food centers, we have allowed for some exemption, allowing for unvaccinated people to go, but with the group size restrictions in place, and that applies irrespective of age, whether young or old. In addition to that, there are additional restrictions put in place or additional modifications of activities so as to further reduce the risk of spread in certain settings. So MOE has looked at this, and in the home setting, to further reduce close contact between children, home-based learning, where possible, becomes an effective strategy to adopt. And that's why the school children, whether it's 12 years, slightly older, in the primary or secondary schools, are on to home-based learning. In the older population, even in the institutes of higher learning, where possible, the institutes of higher learning are also exploring minimizing physical contact. So a number of the institutes of higher learning have offered virtual learning pathways for the older children who are in these institutes as well. So you may have a 17-year-old person in one of these institutes of higher learning, also on home-based learning or virtual learning at home. So it's not just confined necessarily to the younger children, but it's all based on the principle that we want them to minimize these interactions with others so as to minimize the potential for further spread in these closed settings, particularly during the stabilization phase.
I had wanted to just to add on to what Kenneth has mentioned. Actually, the starting point is that during this stabilization phase, the key strategy is to minimize social interaction in order for us to slow down the growth in the number of cases. And that is to allow the hospital system to get ready for the health protocol to transit to a new protocol and for the facilities to be built. So I think this is during this period, the key focus is to reduce as much interaction as possible. And that is also why we also encourage workplaces to work from home where it is possible, and school-based learning as well. So I think that is a starting point, but there will be essential activities like seniors having to go out to get sunshine and to exercise and to make sure they get fresh air. Those are necessary and important, but we need to encourage them to do so safely. So I think that's a starting point. Therefore, the idea is to minimize as much as we can social interaction in the community. So wherever possible, we want to allow people to do that.
Thank you, Ministers, DMS. The next question is from Po Ling from Channel 8 News. Po Ling?
Hello, hi Ministers and DMS, calling from Channel 8 News here. Just following up on the question about seniors, because I mean, some seniors have actually feedback that they have listened to the government, take the vaccine, take a booster, adhere all to the very strict SMS, protect themselves. But now, like, they're back to square one. They can't go out as freely as they would like to, because of all the increase in cases. So not sure if the task force actually have a timeline or target for them to look forward to. Under what kind of circumstances would they be able to resume their social activities? I mean, they also want to spend the last few years of their life meaningfully, because some of them might feel that now that they are at home, they have actually nothing to do and their life is quite aimless. Yeah, would appreciate if you can get a Chinese reply as well. Thank you.
Well, let me start first. Timeline that you talked about is also linked to what moves we make beyond this stabilization phase, because as we've said, stabilization phase is a temporary phase where we are putting in some breaks, tightening some measures, particularly group sizes, in order to address the more urgent issue of protecting our healthcare system, resolving all the issues, ironing out the protocols. And then once we are ready, we will be able to move forward and continue with our reopening plans. So that is the timeline, that as we continue with our reopening plans, then group sizes, activities, these will be able to continue, and seniors, or in fact anyone in Singapore, young and old, can look forward to that continued resumption of activities. Seniors, however, even as we resume these activities, do need to take extra precautions, only because now that we understand better the nature of the virus and the disease, we know that seniors are more vulnerable. And therefore, even as we resume activities and continue with activities, I think we'll just want to make sure that we have adequate safeguards and protection for our seniors, because yes, they may be vaccinated, but if they are not careful to catch the virus, a higher proportion of seniors are likely to fall seriously ill compared to younger folks. That's what the data shows. It doesn't mean then that they should curtail everything, obviously, because If they were to do so, they also do not get to enjoy quality living. So we have to find the right balance, as I said, and eventually when we get out of the stabilization phase, many of them can indeed look forward to a resumption of activities.
Maybe,
让我
okay, you can go ahead.
You want me to go first or you go first?
Yeah, go ahead and translate.
OK， 让我用华语先回答，然后我翻译成英文。这个冠状病毒，包括德尔塔这个变种病毒呢，相当阴险啊，就专门就是攻击我们的年长者。所以在很多世界各地很多国家，去年还没有疫苗接种的时候，他们就经历了这样很大的这个传染波，很多人死亡，成千上万，很多国家都遭遇到这样的不幸的一个灾难。不幸身亡的人呢，很多都是年长者。新加坡我们绝对不要这样的事情能够发生，我们要保护我们的年长者。所以整个2020年，我们都没有什么开放啊，大家的行动都约束了，甚至在去年4月的时候，我们有一个就是阻断时期，把疫情压制下来。所以这样不断的，我们一年度过了2020年，死亡的人不多。接下来就开始接种疫苗，优先还是我们年长者。年长者接种过后，打追加剂优先也是我们年长者。我们在医疗设施这方面不断的扩大为了什么？就是担心年长者生病，患上严重疾病怎么办？医院要够床位、够医生、够护士来照顾我们的年长者。所以一直来这20个月，冠状病毒主要攻击的都是年长者。我们尽心尽力的保护我们的年长者。现在疫苗接种82%、83%了，开始开放了。开放过后，一些没有接种疫苗的年长者，也是不幸得到严重的疾病，甚至身亡。所以，但是我们迟早要开放。开放过后，但是还是要继续保护我们的年长者。所以我们现在劝告年长者，在这个时候少一点出去。像王训财部长所说的，这是暂时的，要几个月呢？我们不知道，要几个星期、几个月，要多久？我们不知道。但我们知道，现在出外社交的时机还不成熟，大家约束一点。我们经历了20个月，一直不断的保护年长者，大家耐心一下。这个风波过后会重见天日，大家又可以跑出来，一起参加社交活动。So I repeat that in English. Long and short of it, I was mentioning that last year, the Delta variant, the wild type, and Alpha variant, COVID-19 tend to attack seniors more. That's why last year, many countries went through big waves, many casualties, tens of thousands in many countries, and many of them are actually seniors. Singapore will not let that happen, and we did not let that happen, which is why we went through a lot of restrictions. We went through a circuit breaker to suppress the transmission for the whole of last year. And then when we had vaccinations, we put priority in the seniors. When we have boosters, we put priority for the seniors. So all this while, we try our best to protect our seniors, knowing the behavior of this virus. But now that almost 85% of our population is fully vaccinated, we have to progressively open up. And as we do so, we still know that unvaccinated seniors are at the greatest danger, at the highest risk. And so we continue to try to vaccinate them as much as possible. And during this period, when we are still peaking in this transmission, we advise our seniors, try to go out less, be careful, and take extra precaution. It is temporary, but how many weeks, how many months it will take, we wouldn't know. But now is still not the time but we have come so far. We seek your understanding. Let's endure a bit more, work together. We will be able to get past this wave, and we will emerge on the other side with new freedoms and optimism and confidence to deal with this virus.
Thank you, ministers.
And move on to the next question.
Yeah, the final question comes from Evgeny from Russian media Itatas. Evgeny?
Good evening. Thank you for taking my question. So my question concerning the new requirement that all work pass holders must be fully vaccinated before arrival to Singapore. So I just want to clarify what vaccine they should be vaccinated before. Number of countries they're using vaccine which is not in the list of WHO. Thank you.
Yeah, thank you very much for the question. At this time, we recognize as fully vaccinated individuals who have been vaccinated with vaccines on the WHO EOL list, in addition, of course, to the vaccines that we recognize in Singapore under the full registration or PISA registration status. They currently are the same, one and the same, although the WHO EOL list is much broader. So that would be the guide. As long as the vaccines are on the WHO EOL list, we would be recognizing these as meeting the requirements for being fully vaccinated.